So right away, I'm going to see, obviously, if they have any questions, but also we're going to talk about what to expect, side effects, and expectations as far as what they need to be doing to make sure that their outcomes are the best. And one of the main things that I stress, and I can do this with confidence because a lot of the doctors in my area that are making referrals to me, I see a lot of, I have a lot of doctors, I have a lot of practitioners who I see a lot of their patients. And so we have a good relationship and we're both on the same page. When it comes to these medications, yes, there's a protocol. You get on, let's use Zepbound. You get on 2.5 and then you go to 5 after 4 weeks and then you go to 7.5 and so on. I have had people on these medications for a year. The highest dose that one of my clients is on is 10 milligrams. And the max dose of Zepbound is 15, right? You're going 2.5, 5, 7.5, 10, 12.5, 15. And that person who's on 10, we're not going any higher. She's not going to need to go any higher. She's hit likely her weight goal. Her appetite, what I find is actually their appetite, even the medication seems to be stronger the smaller that they get or the more weight they lose. And so we're even talking about her going down to 7.5 and then sort of weaning down, right? So that she's not on this medication for her whole life. Now, some people need to be on the medication their whole life, and that's okay. If that's you, that's fine. That is nothing to be ashamed of. These medications are incredibly helpful. I see wonderful outcomes with them when they're used correctly. So I think that many, many, many people can benefit from them, and I am not against them. I am for them being used responsibly, and I could get off on a whole tangent on that. Like I said earlier, the medication is a tool. I relate it to taking an antidepressant, right? If you take an antidepressant, kind of takes the edge off, and then you can focus on healing yourself, working with a therapist, working on the things that you are struggling with. Same thing with anti-anxiety medication. This is another tool so that you can focus on your food change behavior habits, such as portion control, water intake, and increasing your fruits and vegetables, and making sure you're getting enough protein, and not overeating on sweets, and changing your relationship with food. Because there's a lot of people who just don't believe that they can do it, right? That they can lose weight. This medication helps them to almost regain focus. I equate it to having the bumpers on or to have the training wheels on. So we put some training wheels on, we try some things, we use our tools. Sometimes, we're going to stumble and we're not going to do so great. And then we need to reassess and get back into using our tools, having our balanced way of eating. But these medications are a wonderful tool to help you be able to execute on that. They are not a miracle drug. They are amazing. They are great. There's a lot of really great benefits, including improved cardiovascular function or cardiovascular benefits, so heart benefits, the anti-inflammation. So these drugs seem to really reduce inflammation in the body. And so if you have knee pain or arthritis or things like that, it can be really helpful. And of course, if you have a lot of pain, chronic pain, acute pain, let's say you injured yourself or whatever, that can keep you from doing activities. That can keep you from going up the stairs. It can keep you from exercising. So if we can decrease overall inflammation, we can see really good benefits when it comes to improving physical activity. The other thing is a lot of my clients and a lot of people have this chronic underlying inflammation, whether it be from insulin resistance. The body's just being reactive because of the quality of food you're eating, or maybe it's because there's an injury and you have arthritis and it sends out the stress hormone. There's a lot of reasons why we can have chronic inflammation. And if we can quiet that with the use of these medications, we can help to calm the body down so that it can focus on repairing. It can focus on healthy weight loss. Because when the body's under a lot of stress and when it's inflamed, what I find is it'll just hold on. It'll hold on to excess body fat. It'll store more body fat. You'll see, abdominal fat deposits. When we can decrease the stress on the body, it really does do better and thrive. It does improve insulin resistance. So insulin and sugar hold hands inside the body and they go inside the cell and everybody's happy. What happens with insulin resistance, which is very, very common, and again, I see a lot of people with this, is you have the cell, you have lots of sugar, but this door won't open.